Los Angeles County public health officials are once again strongly recommending that people wear masks in all indoor public settings.
Experts aren't just concerned about the recent rise in COVID cases, but also the spike of RSV and flu cases as well. Joining us now is Dr. Anne Rimoin. She's a professor at UCLA's Department of Epidemiology and also the director of UCLA's Center of Global and Immigrant Health. Dr. Rimoin, good morning. Thank you so much for being with us.
Good morning. It's nice to be here.
So is there a way to quickly distinguish the difference between COVID, flu, and RSV if you're trying to diagnose yourself or if you have children in the household? How can you tell which is which?
Well, it's going to be really hard to tell which is which just by symptoms because they really are fairly similar. So I think the best thing that you can think about here is where can you get some good data? Have you been exposed to people with things that with one of these viruses that know they have it? COVID testing is still available. You can rapid test, you can go get a PCR test. Rapid tests are pretty widely available, so that's a good way to rule that out whether or not it is COVID. And I think the key here at this point is there are a lot of things that we can do to prevent getting it right before the holidays and through this whole season. It's always going back to those basics. You can wear masks, you can hand wash, you can have good ventilation, keep your activities outdoors. That will help ensure you have a safer and healthier Thanksgiving.
We're hearing about a lot of local hospitals treating children with RSV, and we're also hearing lots of stories of RSV making its way through classrooms and schools. Why is it so bad for kids this year, RSV?
Well, we're just seeing a huge increase in cases. Some of it is that we've been wearing masks. We've been doing all of these mitigation measures for the last couple of years. People haven't been getting sick, and so more people are vulnerable, and so we're seeing more cases. And some years we just have a bad season as well. So it's hard to really parse it all out to be able to say definitively why. But we can assume that it's the lack of measures, that now everybody's getting exposed to viruses, more people are out, and people who have not had it over the past couple of years.
A lot of kids have lingering coughs, adults as well, after they get sick, where they have that kind of dry, lingering cough. And is there a difference, I think, between coughs? Sometimes you just have that dry cough and it doesn't produce anything. Other times it does. What do we need to be concerned about when it comes to that?
Well, I think that the key here is you should ask your doctor if you have a concern about what kind of a cough you have. The real thing that we can do at this point is prevent getting these viruses. And those are all the things that we know. And that's why the Department of Public Health here has suggested, going into indoor settings, you might want to wear a mask.
What should we know about the two new COVID subvariants that are now more dominant than BA.5? Do they transmit easier? Are they more serious?
So what we know about these two new variants is that they're starting to really increase in proportion of cases, and soon will probably take over as the two key dominant strains. What we've seen here is that these particular variants may be more immune evasive, so be able to break through vaccines, but also that these monoclonal antibodies that people are using to be able to treat COVID-19 are not as effective. So, every time we see a new variant, it seems to up its game in terms of immune evasion or being able to get past some of these treatments that we have. But that's why I keep saying here, the key is better to stay out of trouble than to get out of trouble, and avoid it if you can.
And you mentioned what to do when it comes to, getting together for the holidays. Obviously, Thanksgiving is next week. You mentioned if you can celebrate outdoors, but any other tips for people as they celebrate?
Yeah, I think there are a number of things that people can do. We have to just kind of go back to the basics. Remember that we're starting to see a lot of respiratory pathogens increase, and it's not just COVID, it's flu, it's RSV, just like you've discussed. So, if you don't feel well, you might want to excuse yourself from holiday. The other thing is get comfortable discussing what your risk tolerance is with the people that are going to be around you. How do they feel about it? Are there people who are vulnerable? You might want to tailor your how you're going to celebrate around the most vulnerable people in your group. And so, things that you can do, you can open up windows and doors, you can take activities outside, you can wear masks when you're indoors, you can separate out a little bit, and you can also test right before getting together. That's one thing that people can do that really might reduce the risk. That's just for COVID, but the testing. But all of these other things will reduce the potential of getting some of these other viruses. We get together with our parents, our grandparents, our loved ones that might be a little older or immunocompromised. So just building in some of these very practical measures might be helpful, and then make it more enjoyable for everyone. We're in a very different phase right now of this pandemic. We do have vaccines. That's another thing that you can do, get boosted. We have all of these different methods that we know do make a very big difference. So incorporating what you can to make it safer for some of our older and more vulnerable population is going to go a long way.
Excellent advice. Always good to see you. Thank you so much. Dr. Anne Rimoin is the director of UCLA's Center of Global and Immigrant Health, and you can follow her on Twitter at Anne Rimoin, or A Rimoin, I should say, at A Rimoin. Thank you so much.
Thank you, doctor.